patients throughout the hospital and also out in community. We follow the patient's journey from being in hospital through out into community, and we go and support them out there. We also prevent patients from being admitted into hospital.
I mean, COPD just isn't just smoking. They say round about, is it every 3 people out of 10 or potentially get COPD, but some of those patients have just had carbon contact. Because we live in the Western world, the carbon that we come across tends to be smoking. But if we didn't live in the Western world, it would be through cooking or that kind of stuff. But sometimes it's just the fact that they're in an industrial area, so the coal miners used to get it, cotton mill workers. Although it's not quite as prevalent, those people who used to work in those industries are now coming through.
The amount of times we see an individual patient can vary. It's all based on an individual basis. Their needs can change. Patients can have what we call an exacerbation, which is a bit like a lung attack, if you like, and they can recur quite frequently, and then they might have a lapse for a while. So it's very, very different for each individual. One of the treatments to help with COPD is pulmonary rehabilitation, and this is a 6 weeks programme, twice a week for 2 hours a week, and for an hour each time there's exercises, and they build up from these exercises to the end of the 6 weeks, and they are able to increase and do a lot more activity. It gives them confidence as well, and it reconditions the chest. Also rely on us a lot to help them in community when they have these exacerbations, whether they're an infection or a non-exacerbation, and because they can get quite breathless, short of breath and debilitated, and it makes them quite isolated as well, and it also has a massive impact on their self-esteem and their social things with their family. So we have to look at their how they feel. Their anxiety and depression is something that we touch on and that we look at.
I think success, you have to rephrase it in a way that your success is in how your patient benefits from your service, isn't it? So success is not that you've got them better for us, is it? Success is in whatever way you've helped that patient, and that may be that you've got them out of hospital, that you've prevented them from coming to hospital, or that you've given them some advice that they didn't know about.